Welcome, everyone. Um, I am Beverly Jacobson. I'm the founder of Verity's Village, and I'm so excited to be here with you this evening. I am going to pass this over to Kathryn. Kathryn, many of you may already know her because she's been so active and engaged in our community for 2.5+ years now. She was one of our founding members, a veteran mama, a NICU nurse as well. And she is going to share with us some information about hospice care, palliative care, comfort care. What do these terms mean? And we would like to hear from you what questions you have, what concerns you have about all of this. But hopefully this will be a really good and helpful conversation that will be a resource for mamas and dads that are to come in the future as well. So without further ado, Kathryn, take it away.
Hi, everyone. Like Beverly said, my name's Kathryn. I joined from diagnosis to delivery when I was about 15 weeks pregnant with my daughter, Indiana. I was searching for resources and help when I received her diagnosis of trisomy 18. I'm also, like Beverly said, a NICU nurse, and I found a lot of my journey was really hard and complicated, and I can't imagine doing it without my nursing degree and my history in the NICU. So one of the major things that I've found talking to other moms who've just received a life-limiting diagnosis, that they're confused. We hear the words comfort care, palliative care, hospice care, and they're all different. A lot of people don't know that. So Beverly and I were talking, and we decided that we should hop on and kind of explain so people understand when they're talking to their care teams the difference. So I will start with the term comfort care. You hear comfort care a lot when you're doing your planning in your initial stages. I don't know about Beverly, but that was one of the first things I heard. Would you like to plan for comfort care? So comfort care would be no intervention at all for your baby. They're born and they would be given to you with nothing to kind of support their life besides, comfort sustaining measures. So depending on the child, whether it be, sometimes a small dose of an anxiety medication or a small dose of a pain medication if they look uncomfortable. So you would basically be, enjoying all your moments with your child with no intervention from any medical professional while you're at the hospital. Some people can bring their children home on comfort care. So that would not include oxygen or any monitoring. I don't know if, Beverly, can you think of any questions to go along with comfort care?
Not off the top of my head.
Okay.
I do feel like I have heard people, and maybe this is a question, I'm just kind of thinking out loud. I have heard people say they might use the term comfort care with a feeding tube or something like that. So is it, from what you're saying, it sounds like that's not technically what comfort care encompasses.
So comfort care, that would be a comfort measure if they were, hungry.
Okay.
To take away that comfort. So there would be more of a hospice aspect with that too. So you could go, so palliative care, I'll jump into that because that'll make a little more sense. So palliative care versus like a straight hospice. Palliative care is supportive measures along with treatments. So that would include things like oxygen, a tracheostomy tube, a ventilator, things like that. So it's a large array. So it's supportive treatment as well as curative treatment. So it's both things. So comfort care, you can go home on comfort care with hospice, which would include things like feeding tubes, maybe a little bit of oxygen, things like that to keep your baby comfortable. Whereas palliative care is supportive care, but it's also looking for like life extension. Which there's so many different terms that get thrown out. I have, all sorts of things I can send anybody to kind of explain things and explain steps. So it'll make it easier when you're meeting with your care team. And, there's things that they'll talk about, like a do not resuscitate. So I don't know if people know what that means. So that would be do not give CPR, do not give things like chest compressions or rescue breaths. Also, it would include like electroshock to the heart, things like that. So what Beverly and I were talking about earlier, and I didn't realize she didn't know, and maybe a lot of people don't know, you can choose to be a do not resuscitate or a DNR, but still say, yes, I want my child intubated. So you could have a breathing tube put in to support your baby and still have a DNR. So that's what we did for our baby. So she needed a breathing tube. And we were planning on going home with palliative care, which included, a tracheostomy to go home to our own home and, manage her at home. So we were going to go home with palliative care in hope, with hopes for her to live at home with us. So you can choose to do not resuscitate, but still intubate to extend, life and give them, the support they need with their breathing. I think that's a common thing that we don't think about a lot and probably isn't brought up in the medical, team's eyes. So when it was explained to me initially, I wasn't given that support or direction where I sort of brought that up on my own terms.
Which you knew to bring up because
Yes.
of your nursing background. Like, I
Yes.
think when we were talking on the phone this morning, you used the term, because I've heard DNR, but I had not heard DNI. So do not intubate could be
Yes.
another directive that some
Yeah.
parents may say, we don't want a tube
One,
down our
two.
baby's throats. And so so that was helpful to know that, first of all, that's a thing, that's a term. And just to have the language around these things, it's really hard to know. Like you said, if it weren't for your nursing background, you wouldn't have known necessarily what to ask for or how to advocate. So I appreciate you bringing that up too and explaining some of the nuances.
And there's so many different routes that each family can take based on their feelings and their preferences. No one right or wrong. It has to be what's right for your family. Some people would say, they're okay with a tube going through the nose or the mouth into the stomach, but they don't want the surgical implanted like G tube or the gastrostomy tube. So I think as time goes on, these questions will get asked, and we're always here to answer those questions. And I think that's the most important thing about this journey is finding the resources and the support to help make the decisions and understand the decisions that are being made.
Yes. I know in our book, actually, I should go grab one for a little show and tell, but From Diagnosis to Delivery, which if you get a welcome packet from us, you will have the book in your hands. There is a chapter in there, and I'll go find it because I'll throw a question to Kathryn here for her to answer, and I'll go get it so you can see it and I can find the chapter. So if you do have the book and you haven't read all the way through it, there is a chapter, there is a discussion in there that talks about, well, what kind of interventions might my baby need? Because I know my mom was a nurse, but I just was never interested in that. I wasn't around hospital stuff. And so everything that I learned while I was pregnant with Verity, and now since having Verity and interacting with so many parents, all of that was brand new to me. I had heard of a trach, but I didn't even know what it was. I didn't know why people would choose it. It seemed so scary to me. And
Mhm.
I honestly kind of went into the birthing room thinking, I hope my baby doesn't need a trach because I don't know if I can do that. And then I didn't even know if that was an appropriate intervention at that stage. So
Mhm.
let me just ask you, what are some interventions? I've heard you say oxygen and feeding tubes, but for the mama who's just coming in, has a diagnosis, and maybe isn't quite sure what the ramifications of that particular diagnosis are, let alone what they are for her unique child,
Yeah.
what are some things that she might hear, equipment and terms that she might need to be familiar with?
So I think nasal cannula, which would be, you see a lot of older people in our communities maybe going out with their nasal cannulas, which is a soft plastic tube with two little kind of smaller tubes that go into your nose. It's soft and flexible, and it attaches to either a concentrator or an oxygen tank that you can have in your home, or it's portable. So that would be a nasal cannula. And then from there, there's different variations of a higher flow of oxygen. So it's um, high flow cannula, or there's airvo. There's all different terms. Heated flow cannula. So it looks like a nasal cannula, but it's more pressurized oxygen blended with a percentage of oxygen at the same time. So it's some pressure to keep the lungs open, as well as a supplement of oxygen like a nasal cannula would give you. There's also CPAP, which is continuous air pressure, um, or there's a BiPAP, which is another form of CPAP. It's just different phases it's very technical, but it's either a mask or a even larger tube in the nose. And then you would go to an intubation, which is the throat, the tube through the mouth, into the lungs, down the throat, or sometimes they put that same tube through the nose. So babies with cleft palates or lips, sometimes they go through the nose um, versus the mouth, which is all very normal um, for, babies in the NICU. So, premature babies or a baby with, some sort of diagnosis. Um, a lot of times you see our babies with trisomy 13 or 18, or, any of the various diagnoses with a tracheostomy tube. So that would be more of a long-term solution where you could come home. It would Sometimes our babies have floppy airways, so we need the tracheostomy tubes for our babies, and they don't as much need the oxygen or the pressure. Sometimes they need to go home on a home vent, so this is a step that is taken later on in life. So the tracheostomy is, a couple months into your journey usually, depending on the baby. I know it's a lot of information, and a lot of things to think about. I could definitely come up with a list that we could post with all the different terms and um, equipment, kind of, and with little pictures to make it easier to understand.
I've actually thought, and back when I started the support group, I initially thought of like a brochure or an acronyms,
Mhm.
kind of a glossary of terms, because a lot of these get thrown around. And if you're not familiar with it, it just, uh, I
It's
remember being,
overwhelming.
yeah, I remember being a new Air Force wife and there were all these acronyms and everybody else knew what was going on. I'm like, what does this mean? So Kathryn, if you would love to do that, that would
Yes,
be
I could
amazing.
do that.
That's a tool.
Absolutely.
I will say that in the book, it's chapter 10. It's called "What Does Your Medical Team Say?" because we go through, what does the research say? What does the medical team say? And then what do you say? Because you're the mom,
Mhm.
you're the dad. Like, you are going to have to live with the decisions, and it's your baby. You care the most about the outcome here. So research might say one thing, your medical team might say one thing, but your gut may be telling you something completely different. And we all know mama gut is real. So that chapter is kind of where we're touching on this topic. It does give a definition of comfort, hospice, and palliative care, which you can take what you've gotten tonight from Kathryn and kind of compare and just see what's there. There's some possible interventions in there. And then there's a personal story from a mama. Mary is her name, and she's actually in the diagnosis to delivery group, kind of as just a resource and an encourager. She's a great one to be able to share openly. And she shares a very difficult story. So it just comes down to, and Kathryn, you've alluded to it beautifully, there's no right or wrong answer here, which I think is, I don't know if that's freeing, but it's also really difficult because we all want to do the right thing,
Mhm.
especially for our precious children. We love these babies and want to do the best, and sometimes there's just not an easy answer. And so I hope that this discussion at least is helping you think through some things that maybe you didn't think through beforehand. Or I know sometimes too we want to be like, I don't even want to think about this. This is just
Mhm.
not where any of us choose to be. But this is, I think it's been helpful. I would have loved, some of these terms were introduced to me early in our journey with the diagnosis, and frankly, it was quite alarming the way they were introduced. Looking back on it, I was just, I felt like I was being given the third degree and expected to know all these answers. And I didn't even know what she meant by hospice care and these other things. And it just was a little bit traumatic, honestly, looking back. I didn't know what to make of it all. So that that is not, we want you all to have the tools to make decisions. So Kathryn, is there anything else that you wanted to share? I've been monitoring. I don't see any questions that have popped up yet,
Yeah.
but of course
I
people can
think the
comment.
biggest thing is this is such a personal journey. Whether you decide to go a comfort care route versus hospice or palliative care, it's such a personal decision for you and your family. And not, you know, some babies, no matter what the doctors do, even with a breathing tube, it doesn't support them enough. So I think the main takeaway is it's nothing that you did wrong, and it's nothing that we can control. And one moment I was holding my daughter and we were preparing for a tracheostomy, and things looked great and she looked great, and a half an hour later she was gone, and there was no there was no decision making to be made. There was no leading up to it. It was God called her home in that moment. It I didn't have any decision making in that. It was her time. So whether your baby gets to live many, many years or doesn't make it out of the delivery room, it's not your fault. And it's not, I think that's the biggest thing. I think that's the hardest thing for sometimes even me to look at and see living babies. And I know I'm so lucky that I got 6 weeks in one day, because there's lots of moms that didn't get that time. And no matter what decisions you make, and you did your best for your baby. I think that's the hardest thing in all of this that we have to remember.
Mhm. Well said. Well said. Thank you, Kathryn. We have one more person on the call, and I am not going to call her out by name, but I'm going to give her the opportunity if she wants to unmute and speak or ask anything. Certainly no pressure to do so. We made that clear that, she didn't have to, but she wanted to pop in and listen as well. So um, Otherwise, let me just check over on our group. I don't see any written comments, so unless
Okay.
I'm somehow missing them, hopefully this is just encouraging and helpful. Good thoughts.
And if anybody like sees this and comes up with questions, feel free to message me anytime. I'm always available and I'm always happy to answer any questions that I can. And if I can't answer, I will find somebody who can.
Good evening, everyone. My name's Annie. I am a nurse practitioner um, as well, and I work in Southern California. Wasn't planning to be on here to necessarily share any official words of wisdom, but in hearing the conversation, I would just echo the things that Kathryn and Beverly have said, that this is a really personal decision to be made, and all of the medical terms can get cumbersome and confusing. And so when I work with families who find themselves in this very difficult situation, making hard choices, trying to think forward thinking about something that might be happening a week or two from now, or maybe still several months from now, it can be really difficult to consider all of the options. And many times, despite our best efforts, doctors and nurses and other healthcare providers forget that sometimes we're speaking a foreign language, though it's maybe English or Spanish, your primary language, the terminology is still foreign. So always remembering to ask for an explanation or say, I didn't understand what you meant by that, or I don't know what comfort care means. Can you help me understand? Is a great place to start. And generally what I tell families is to just think on a spectrum. If we know we only had a limited amount of time with your precious little boy or little girl, whether that was 5 minutes or 5 hours or 5 days, thinking of the big picture. How would you want to spend those minutes, hours, days, or weeks? And if you want that to be extending physical life for as much time as possible, then going more of a palliative focused method, or even a full aggressive medical care intervention, is kind of the spectrum that you would want to go to. But if you are a family who, if you have limited time, the most important thing is being together, not being separated, and helping to keep your baby as comfortable as possible, then going a purely comfort focused or purely hospice focused is more of the spectrum of things that you would want to lean towards and find out more information about. So if you can think of your overarching goal, whether that's living as long as possible, or whether that's living as pain-free and comfortable and together as possible, and being able to just tell your medical team, this is the most important thing. Being together, not being separated, keeping my baby comfortable, then that will help to guide them to address the medical interventions that will help your son or daughter to live their life, however short or long it is, in that values-driven place. And if your goal is to have your baby live as long as possible, and you're willing to accept some of the things that might be a little uncomfortable or painful at times, or willing to accept being separated from your little one, then telling them living as long as possible is the most important thing will help them to then explain some of the other possible interventions, like the CPAP or the intubation or the tracheostomy or different feeding tubes. And then you can talk more about what those specific interventions look like and decide if those are really something that would help you meet your goals or help your baby meet the goals that you have for your little one.
That was so good. Thank you, Annie. So practical. And as a mama who walked this journey with no medical experience, I think just what you said is so helpful to process through that. I love you use the term values driven, and I think it comes down to that. And I think too, I may not be alone in this, that I don't do my best thinking on my feet. I often have to really process things, and especially because receiving a prenatal diagnosis is traumatic. And so there is an element, I'm telling you, my brain has changed. I do not process information the same way I used to before this whole journey. And so I think giving yourself time and space to receive the information and then kind of sit with it for a little bit, and then what questions surface that you don't have to ask them all in that one appointment. You can come back, you can have a phone call or my chart if there's, you know, a messaging system.
Mhm.
So have that freedom to just sit with it and, you know, pray about it, think about it, talk to your spouse about it, talk to your family about it. And just know you don't have to have all the answers in that one conversation, but it's an ongoing dialogue, or it should be, right, with your
And
medical providers.
just because you made one decision doesn't mean you can't change your mind as
Mhm.
you go.
Yes. Yep.
I
Very
often tell
good.
families that very thing when we're working on an advanced care birth plan, kind of helping them to write out what their values and goals are, is that just because we write this in paper today, you know, doesn't mean this is set in stone. There's always the opportunity to change and to modify your decisions. You know, we can change the paper, change what we've written, or on the day of the delivery, if in that moment your heart or your gut or your mama instinct is telling you, actually, I've changed my mind, then you just speak up in that moment and we modify the plan and we go with what feels best at that point in time.
I
Yes.
think as just always make sure if you don't understand it in the moment, you do not have to answer it. You can, I need more information.
Mhm. Very good. I think we went into the delivery room with the idea that we wanted to stabilize and assess. We just wanted to see what Verity was telling us that she needed. And
Mhm.
as much as possible, our first goal was to meet her alive, if at all possible. And then it was like, oh, okay, now we have the opportunity to set another goal and another goal and see, just kind of evaluate along the way. And like you said, the ability, the freedom to change your mind based on the information that you receive in the moment is really important too, to know that you don't have to be dragged into something that all of a sudden you feel like that's not the right course for your little one. Wonderful. Thank you, ladies, for this dialogue. I think it was helpful for all three of us to kind of go
Yeah,
back and forth, and it reminded
absolutely.
us of other important things. And so I think we'll go ahead and wrap this up. Um, Reach out to Kathryn or comment below on the video if you would like copies of, she has some resources. If you do not have our book From Diagnosis to Delivery, there is a pregnancy journal that goes along with it. This will also be a good resource to help you prepare a birth plan. There's a chapter that talks about preparing for loss. So if you're not going to have much time with your baby, like Annie was saying, what are some of the most important things to you? And there's a chapter called Preparing for Life, and some of the things to consider. Okay, what if, you know, your baby is able to live longer than people are expecting? So it's hard. It's so hard to sit in the middle and not know exactly how to plan, but we want to give you all the help and support that we can, and just know that you can reach out. And so many wonderful moms have walked this journey, and they choose to remain involved in this group because they want to share their story. So if you're listening to this and you're one of those mamas that you've gone through this and you're willing to share, please drop your story below, or make your own post, or connect with somebody that's just on your heart that seems to have a similar journey. That's what this is all about, is the connections and the support. All right, we'll wrap it up there. Have a good evening. And if you have an idea for our next dialogue, our next panel discussion, I'm not sure what we're going to call these little chats, but I think it would be helpful. So let us know when we'll create an event around your question.